Okay, everyone, this is Walt Kasmir, your favorite certified senior advisor. We are logged on. We're waiting for everyone to log in to the chat room here. I'm going to check in and see how many attendees we have here. All right, okay, I see some people here. Feel free to chat away. We will look at all those comments and such. And if you have a specific question, you guys can chat among yourselves. But if you have a question, you can click the question button in the chat. Okay, so again, welcome to the webinar. It will be roughly about 26 minutes long, and then I will open it up and we will have a Q&A. Again, thank you for giving me your valuable time, but I do think that it will be some valuable information. Medicaid is its own entity. Medicare is its own entity, and they do have a lot of documents that will explain this stuff, but I try to extract all the essentials and put it into something very concise. So the topic of the night is Medicare Plan choices. It is complicated, but we can boil it down to two choices. You have Medicare A and B, that's your original Medicare, and you have Advantage plans. Part A of original Medicare is designed to pay for hospital bills. Part B is designed to pay for doctor bills. And as you can see, you will have a 20% coinsurance. So that means that 80% of your bills will be covered. 20% will be left. And that is the whole essence of a Medigap plan that is implemented when you buy original Medicare. And for comprehension's sake, I have divided this into left and right columns and choices of plans. So on the left, you have original Medicare, parts A and B. Parts A and B are hospital bills being paid for Part A, doctor bills being paid for in Part B. Down at the bottom, we have Part D, the drug plan. Believe it or not, Medicare and Parts A and B do not cover prescription drugs. As you well know, most seniors are taking at least 5 to 10 medications. So this is an essential component of medical expenses. We have to make sure that we have some source of funding to cover these prescriptions. And as you can see, I went from A to B to D. There is really no Part C. If there were a Part C, that's what Medigap would be. Medigap, as I said earlier, there's a gap that's not left, that's unpaid of 20%. So these Medigap plans are designed to cover that 20% that isn't paid for. So in the end, you patch all of these together, you have parts A, B, and C, A, B, C, and D, and you have your medical expenses paid for. That's the left side of your choices. On the right side, we have Medigap policies. They, at the center of it all, they are managed by an HMO, Health Maintenance Organization. We're used to these organizations by now. Over the last 20 years, they have taken over, really, and they have the components that most of us have come to understand, at least at some level. They are based on being in a network. You have unpredictable costs because you do have to pay for parts A and B. You have to pay the premiums, and you have to pay the co-payments and deductibles every time you go to the doctor. So the perk of it is that what they advertise on the commercials, United Healthcare is a popular one, that they wrap up Parts A, your hospital bills, Part B, the doctor bills, and a prescription plan, all wrapped in together, and that's the advantage, the quote-unquote advantage. So to recap, you have on the left, original Medicare, Parts A, B, C, and D. Hospital plans, doctor bills, the 20% that's covered after you pay for the Medigap Plan and the prescription plan. Now, the original Medicare plan does not pay for glasses, vision, dental, or hearing aids. So that is something to be taken into account. And unfortunately, some seniors do need those services. So let's talk about the benefits of an Advantage plan. As I mentioned, as I implied, there are some extras included in the Advantage plans. They do wrap up some discount plans and they try to make it more attractive. They have silver sneakers plans in those, free memberships to the gym. They have some dental, some vision, some hearing aid options that, of course, you pay for that. They roll it all into one and make it more attractive. Another benefit is that you can have a low monthly premium or a no monthly premium in the Advantage plan. For people that are on a low budget, this may be something that is attractive to them. Another benefit is there is guaranteed coverage during the initial enrollment plan, not plan, but enrollment period. And you can switch during the annual enrollment period from among Advantage Plan to Advantage Plan. You can't go back and forth from Advantage plans back to original Medicare and pick up a supplement plan to cover the gap, because those are also managed by individual companies and they have underwriting. So if you're too sick, they won't want to cover you. They have actuarial tables and they know how much patients are going to cost them, and they're in business to collect as many premiums as possible and to pay out as very little as possible. So what are the drawbacks of the Advantage plans? As I mentioned, they are based on being in a network. You do have to pay co-pays. You do have to pay deductibles. There's usually a limit, a cap on the out-of-pocket expenses, give or take, generally around $6,000. You do have to go through a gatekeeper as the primary care physician who makes the referrals to get to the specialist. And HMOs also have very aggressive utilization management, meaning that they're watching every dime to make sure that they make a profit. And you have to get procedures pre-approved and all these things. And I work for a healthcare insurance company, and I met the president of the company, and in passing during my orientation as a utilization manager, he said, hey, if you didn't deny, you didn't try. I mean, that's the philosophy of the insurance companies. So that is the type of environment that you will be in if you have to appeal different decisions that they declined, or they said they wouldn't pay for a procedure or so forth. You will have to go head to head with them sometimes. So those are some of the drawbacks of the Advantage plans. So let's talk about the benefits of a Medigap plan. As I mentioned, the Medigap plan is designed to basically pay 100% of your deductibles and coinsurance, that 20% that is left if you only get the original plans A and plan B. Another benefit is that you can go to any doctor that is accepting Medicare patients and accepting Medicare. And the most desirable factor, I think, is you will have predictable medical costs. Once you're paying your Part A, B, C, and D, it will be the same every month. And once, if you choose that, they can't exclude you moving forward. Have a nice table that I found, and it kind of explains a little bit more about this Medigap plan. As you can see, I highlighted right here in the middle, type F. There are type Medicare supplements from A all the way over to N. Different types that cover various amounts of the medical costs, co-payments, co-insurance, deductibles, etc. As you can see, Part F, type, not part, but type F, Medigap Plan, if you look down the middle, it covers 100% of all the excess out-of-pocket expenses that you would have been stuck holding the bag for. Parts A deductible, B deductible, excess charges, 100%. Skilled nursing facility, co-insurance, 100%. Hospice, Medicare Part A and B, the co-insurance, co-payments. Hospital, co-insurance, 100% covered with the Medigap supplement in place. All right, so I want to be balanced. So let's talk about the drawbacks of the Medigap plan. So you do have to find a PCP, a primary care doctor, who accepts Medicare. He has to also be accepting new patients. And you will pay the same co-payment whether you're seeing the doctor or not. Unfortunately, premiums will go up as you age. As I mentioned, these insurance companies are in this business to make as much money as humanly possible. And there usually aren't any extra perks like dental, vision, hearing, silver sneakers, etc. So if those issues are very important, if those are deal breakers, that's a consideration that you have to take into account. So in the end, the best choice really depends on your situation, or if you are helping another person make these decisions, and your mother, your father, or someone else. It really depends on their personal situation. You're forecasting what their health would be, and if they don't have a lot of medical expenses, if they're not going to the doctor all the time, and they want to save money on deductibles and premiums, not deductibles, but premiums, the Medicare Advantage Plan may be the choice for them. If they do go to the doctor regularly, they could end up with paying a lot of extra money by taking the Advantage Plan. The Medicare original plan with the supplement, the Medigap Plan, might be more appealing to that type of elder that is going to the doctor frequently, racking up a lot of bills, if they're in the hospital in and out, or if they want to be able to go to any doctor in the country who's accepting Medicare, and most importantly, have a predictable medical budget. That plan would be more appealing for them. And as I said, these things are complicated. It would be best if you got a multitude of advisors. You have to put together a dream team of professionals that can help you make informed decisions about these things. So that pretty much wraps up our presentation. This brings us to a conclusion, and I just want to leave you with this one final thought on this topic before we bring it back to the Q&A. It's imperative that you do not wait too late to have the critical conversations about aging in America. Sometimes, if you wait too late, by the time you know that you need to make decisions, it's too late to really implement an effective plan. The earlier you start, the better. And the earlier you start with a full complement of informed, educated, credentialed advisors, the better. So let's wrap this up and let's open up the Q&A.